Hello friends, I am Dr. Sundeep Mishra. I served as Senior Professor of Cardiology at All India Institute of Medical Sciences, New Delhi, AIIMS Delhi. And now I have joined as Vice Chancellor of NIMS University and also President of NIMS University and Director of Cardiac Sciences at NIMS University Hospital, Rajasthan, Jaipur. Previously, I have served as Chairman of National Intervention Council and also editor-in-chief of Indian Heart Journal. I was Joint Secretary of Cardiology Society of India and also served as General Secretary of Cardiology Society of India, Delhi branch. I was the organizer of TCT India and also National Intervention Council meeting. I am also a course director of cardiology at Iqramed Academy, a well-known online platform for teaching and learning. Welcome to the Echocardiography training course. This course is especially designed for people who are not cardiologists but who wish to undertake this investigation for their patients. So, echocardiogram is a test that uses ultrasound to show the structure and also function of the heart. Uh, it is called echo for short. It has got several advantages. Number one is that it is a completely harmless investigation because it uses the echo waves which themselves don't cause any harm to the body. The second important thing is that it is a very portable system, so you can take this investigation directly to your patient rather than all the time patient coming to the investigation lab. You can take this equipment, especially the portable one that are available, to your patient to do the test. It has become so valuable that it has become investigation of choice for many of the situations, especially in the cardiology situation. Now, coming to the history, it was Christian Johann Doppler in 1842 who noticed that when the sound waves are coming back from a moving object, depending on whether the object is moving towards you or away from you, their pitch changes. So he made this very important observation, and this was the basis of this whole investigation. Later, it was found that you could generate sound waves by a piezoelectric crystal, which, when activated through a current, could produce the sound waves. And it was Helmholtz Hertz who first time made a commercial ultrasound using this whole technology. So if you look at clinical echo, you can see in front of you this machine, which is an echo machine. There is an operator and there is a patient lying who has his upper part of chest uncovered and has got ECG probes on the chest to make the echo events timed with the ECG events. So that is the most important thing, that you are able to time the movement of the heart with the ECG, and therefore you can make you can look at the timing of the echo events that you are recording. Now, what does echo show? Broadly, what echo shows is, number one, the structure inside the heart. And as you know, in the heart, the various structures are that there are the cavity of atrial cavity, right atrium, left ventricle, right ventricle. Then there is the muscle mass, that is the myocardium. Then there are the valves, and then there is the pericardium. And then great vessels are arising out of the heart. So these are the structures that you can see well on echo. Number two, what it does is also looks at functions of these various structures of the heart. So for example, it looks at the contraction of the ventricles, how they are contracting and relaxing, and that function echo can pick very nicely. It also looks at the movement of the valves, and therefore you can pick the functions of the valves as well. So it looks both at the structure as well as function. Now, where do we use echocardiography? So basically, of course, it is to diagnose heart diseases, and various heart diseases can be diagnosed. It could be any damage to the cardiac structure. it could be valve involvement, it could be chamber involvement, it could be stiffening of the heart muscles in restrictive heart disease, it could be any clot, any tumor, any other structure inside the heart, even pacemaker lead you can look at, and other structures that have been put inside the heart you can look there also. Then you can look just around the heart, in the pericardial cavity, if there is some effusion, you can find that effusion also, and you can also look at normal structure and even the abnormal structure, for example leaking valves or narrowed valves. So those kind of things all you can look uh, at the echo. Moreover, aside from diagnosis, you can also use it to monitor the patient over a long term period, looking at the same structure again and seeing if there is any change. So that change can be picked up in subsequent echo recordings and you can monitor that also. Plus, you have to use echo for further treatment, whether it is a medical treatment or surgical treatment. So echo can be used there as well. Now, the question arises, why should you learn echo? So, is it only for cardiologists or even non-cardiologists can use it? So, we see that there is, more and more patients are having heart problems because of aging population, because many people surviving heart attacks. So, number of heart patients are increasing. So, that is number one. And number two, it has been found that there has been a 3% growth in the number of echocardiograms performed in West. So if in West there is a growth, you can imagine in developing world where more and more patients are now availing of the medical facilities, the number of echocardiograms are going to increase logarithmically. Now, this obviously necessitates that you have to expand and diversify the whole system, and therefore it is, it is now opening up for even non-cardiologists, whether it is a medical person. And in West, you might even know, and even in India, a lot of echocardiograms are performed by technologists. So echo technologists can even perform the echo, although they have to be interpreted by a cardiologist or a trained person only. So in the West, there is a lot of emphasis on increasing the utilization of echo by different expert teams, and they understand that it can be a very innovative and a cost effective method to benefit the patients. So now let us look at how do physicians feel about echocardiogram. So most of the physicians feel that echocardiograms adds to the management of the patient, and 8 out of 10 thought that it is an essential investigation for cardiac diseases. And basically what many people feel is that it might be the investigation of choice, and after doing an echo you might not require any other investigation. So to summarize, we see that echocardiography has become gold standard, at least for managing cardiac diseases. And why so? Because number one, of course, it is low cost. It's the only cost of the equipment. After that, running cost is very low, and therefore you can use it in many patients. In many institutions, about 50 or 200 patients to 200 patients are done in a day in a single echo machine. So it is overall becomes a very low cost procedure. It is also, as I already discussed, near practically harmless, minimally invasive. There are no radiations. It is very easily available now. It is portable, and the echocardiogram can be performed with ease to the patient relatively quickly, and the information it provides can change the whole treatment course, and in some cases it can even be life saving. So that is why it has become gold standard, at least for cardiac diseases. So with this aim, we have designed this module with the goal to study the basic structure of the heart and use the principles of ultrasound to make a diagnosis of heart diseases. Number two, we know that while doing this, what we will try to impart on all the people taking the courses, first thing, to develop sensitivity towards the patient. So this is very important because this is an investigation where there is a close contact between the physician and the patient, or the operator and the patient. So there is a close contact unlike many other investigations like MRI or CT, where there is practically no contact. Here there is a very close contact. Therefore, the doctor should be sensitive to requirements of the patient, whether the patient is having any problem, etc. So those things, number one, we want to instill this feeling in the operator. Number two is the operator has to understand, and what we want to tell you is that the position of patient is very important. So some images are obtained in a different position, so different type of positions are very important, and the location where you place the echo probe is also very important. So this thing you will learn through this whole course, how to position the patient properly and making him comfortable, and how to position your probe properly so that you can obtain the best view and get the best diagnosis. Then third thing that we would want you to learn is to acquire this ability to recognize uh, the problem that the patient is having, and how, by being able to systematically do all the standard views. So you have to understand that there are certain standard views which you have to systematically do, and that will help you recognize the problem and then finally treat it also. Also, we would want you to know how the normal structures of the heart look at echo, because they might look little different from the actual gross pathology, but echocardiographic image of the structures, be it be valve, be it the left ventricle, be it the great vessel like aorta or pulmonary artery, you should know how these structures look, and that is what you would learn during this particular course. Then finally, you would also learn how to look for functions of various structures of the heart, whether it is a valve function, whether it is ventricle function, whether it is great artery function. Those functions, normal functions, you should be able to look. And then after you look at the normal structures, you start looking at abnormal structures, and then once you look at normal and abnormal, you realize the difference, and then you can make a proper diagnosis. So these are the learning objectives of this course. So just to summarize again, what you will learn is the anatomy, what is the normal anatomy of different structures, and what is the abnormal anatomy. The other thing that you will learn is physiology, how these structures function, and if they are abnormal, whether there is a abnormal functions. That will enable you to make the clinical diagnosis in this particular patient, and also you would be able to look at the abnormal things or the pathology of the heart. So all these things you would learn during this particular course. So basically, to summarize, this cartoon shows you that what you look at is the cardiac anatomy, and through that cardiac anatomy, then you look at cardiac physiology, make the cardiac diagnosis, and look at cardiac pathology. So this is the way that it will be done. Now, you may ask before starting the course, what are the things that you should do before starting the course? So what I will recommend is that again look at your anatomy books and physiology books to look at the general structure of the heart, because once you know the normal structure of the heart, and once you do echo, you will know how those structures look at echocardiogram. So it is a good idea before starting this course to just flip through your anatomy books and look at the normal structure of the heart. So that is number one. Plus, I would suggest that you could do some kind of readings, and I have made a list of things, textbooks that you might want to read if you want to supplement this particular course. Although this course we have designed in a way that it will give you a very good uh, demonstration, video demonstration of the whole process, so that you will not depend too much on textbook learning or on a lecture based session followed by quiz. So these are the normal ways why people learn. Here we have planned an interactive kind of digital way, or learning module where you would have the same kind of but transformational learning, which will be much better than the textbook learning, we hope. So let me just take you to the various modules that we have designed for you. It is a 50-hour, I mean approximately or broadly 50-hour module and course where we will have 50 modules. And these are the modules that you will have. First is, of course, why should we do echocardiography, that we are talking. Then there could be other, it can itself take few modules, but then there will be instrumentation in echo, then physics involved in echo, then comprehensive echo examination, which will involve how you get the different echo windows, which can be parasternal window, then apical window, and short axis, long axis window, subcostal window, and suprasternal window. So these are the things that you will learn. Then you would learn about Doppler echo and M mode echo. Then you would learn about Doppler assessment and assessment of right and left ventricular function, chamber evaluation, chamber quantification, diastolic function assessment, and which may be in more parts. Then we will come to, once you learn the normal echo structure, then we will come to abnormalities. We will first start with rheumatic fever, then mitral stenosis, mitral regurgitation, then surgeries, post-surgical patients with mitral valve repair, aortic stenosis, aortic regurgitation, surgeries that are after surgical repair also you would learn. Then then for cases where you need to do a procedure, whether it is a surgical procedure or a transcutaneous aortic valve replacement, for example. So what are the echo parameters that you pick before you send this person for surgery to guide the kind of therapy? So whether it is a percutaneous valve or whether it is a surgical valve, what site you need to use, where you need to implant, how, and those things we will talk about in this module. Then after this, tricuspid valve repair, pulmonary valve disease you would look at. And then for those interventions, what are the criteria that you need to look at, those you will look. Then finally you will come to, you had already looked at the ventricular function, now you will look at ventricular dysfunction, left ventricle, right ventricle, then various causes of those dysfunctions, whether they are myocarditis, dilated cardiomyopathy, perimortem cardiomyopathy, diseases of the heart like Epstein anomaly, endomyocardial fibrosis, then echo of pulmonary artery hypertension with tricuspid regurgitation, then diseases of the lung, how they look at echo, right heart failure, then we will come to coronary artery disease, all the things, then stress testing for coronary artery disease, then we may come to restrictive heart diseases like hypertrophic cardiomyopathy, other kind of restrictive heart diseases, infiltrative heart diseases, pericardial diseases, infective endocarditis, cardiac tumors, masses, thrombus. Then after surgical patient with prosthetic mitral valve, prosthetic aortic valve, other prosthetic tissues, how they look at echo, how you evaluate their function, whether these prostheses are working properly or not working properly, that you will look. Then we will come to congenital heart disease. First, acyanotic congenital heart disease with stenotic or regurgitant lesions. Then acyanotic shunt lesions, which could be left to right shunts. Then we will come to cyanotic congenital heart disease. First with reduced QP, then with increased QP, and then when we do, how to choose your intervention, what are the criteria on echo which help you guide the therapy, whether it is percutaneous therapy or surgical therapy for these people, that we will talk about. Then we will talk about hypertension and hypertrophy. Then we will talk about the other type of echo, which is transesophageal echo. So what we do normally is transthoracic echo, where we place the probe on the chest. But some cases, especially the structures which are at the back of the heart, you may need to put the probe inside your mouth into the esophagus. to look at the back structures of the heart. And for that, we will require something called transesophageal echo. Then once we discuss with you the procedure, then we will show you, once you put the trans echocardiography probe, what are the structures that you can see. Then special situations we will study, like pregnancy, stroke, TIA, which are non-cardiac situations, but where cardiac echo is important. So those we will read. Then we will do a session on focused cardiac ultrasound. So ultrasound for a normal physician, where what all things it can look at, and then echo for systemic diseases. So this will be our basic module. But for some people who would want to do more than this, we will have an advanced module, which will, in addition to this, also include diseases of aorta. We will talk about contrast echocardiography. We will talk about how structures, artifacts come into the echocardiography. Then we will discuss intraoperative echocardiography, ultrasound Doppler for peripheral heart disease, dysynchrony evaluation, and AV optimization, which is useful when you are putting electrophysiological devices in the heart or cardiac assist devices. Then atrial fibrillation, heart failure, cardiac assist device, heart transplantation, tissue Doppler and strain Doppler, fetal echo, 3D echo, and intracardiac echocardiography. So this will be in the advanced module. If some of you want to take the advanced module, so these are all the things that we will again discuss with you.